For being here in a timely manner. Hi, welcome to the Health Occupations and Long-Term Care Subcommittee. It's 12:10 now. I just want to remind all the stakeholders and the members of the subcommittee, this subcommittee is going to continue to meet on Thursdays 15 minutes after session. So it's a variable time. It might be 12:15 or it might be a little earlier. We're going to try and do it, 15 minutes after session so that members have a little bit of time to grab some food before our 1:30 afternoon hearings. So really thankful to the members for cooperating with that. The first bill we have, let me explain what we're going to do with all the bills on our agenda today. So we have two health occupations bills that are relatively non-controversial that I'm expecting we're going to be able to vote on today. First on the agenda, 873 and 811. And then we're going to move on to the three bills that relate to visitation. 983, 806, and 276. And we'll discuss them together because there's a lot of overlap between those bills. And then finally, we will discuss 674. So it's not my expectation we're going to vote on any of those other bills. We have to discuss them, figure out what we want to do, and potentially prepare some new amendments. But for 873 and 811, we'll discuss them now and hopefully be able to vote if the committee feels comfortable with them. So with that, let's talk about 873 first. Lisa, can you remind us about this bill?
Yep. House Bill 873 requires the State Board for Certification of Residential Child Care Program professionals to maintain an electronic roster of all individuals certified by the board for purposes of electronically verifying certification. The roster must be posted on the board's website. An individual without website access may contact the board to verify a certificate. And the bill also repeals the requirement that the board indicate in a renewal notice the date by which a renewal application must be mailed before the certificate expires. There were no amendments.
Right, and this bill exactly identical or very similar passed the House last year?
I believe it's identical to how it passed the House last year.
All right. Delegate Charles, anything you want to add?
No, I just want to let it pass the House last year. It's a simple bill. I don't think it requires much thought to it. Just go ahead and move the bill and get it through committee so we can get it over to the Senate and make this thing happen for the advocates.
All right, so that was moved and anyone on the second?
Second.
Moved and seconded. All in favor of this piece of legislation, say aye.
Aye.
Anyone who's opposed can raise your hand in the participants function. I don't think we have any opposition to this one. Great job. Bill passes unanimously. Thank you, Delegate Charles. We will move on to Delegate Cullison's bill now, which is 811. Lisa, can you remind us about this bill?
House Bill 811 renames the Maryland Social Workers Act as the Maryland Social Workers Practice Act and makes various changes to the act. It requires an individual employed by the federal government and licensed to practice social work in the state to comply with the act. It repeals obsolete provisions related to licensed graduate social workers. It alters the definition of licensed certified social worker. It alters the number of required hours of specified supervision for a licensed certified social worker clinical, redefines the Social Work Rehabilitation Committee as the social worker rehabilitation process, requires the board to include disciplinary history on each electronic license record, specifies the board must approve certain licensees to provide supervision in accordance with regulations, increases the penalty for violating certain provisions of the act, and makes other technical and clarifying changes. There is an amendment that would move the year in which licensees will be required to get criminal background checks as part of the renewal process to 2023.
Great. And Sharon, do we have the stakeholders for this bill in the room now? Sharon's
Yes.
muted, but I think we do. Okay, great. Delegate Cullison, anything you want to add?
No, I just want to thank the board for working with us, for working with the association on this and coming up with an agreeable product. And I would, when it's appropriate, move the amendment.
Well, let's move the amendment now. Does someone want to second it?
Second.
Moved and seconded. Okay. Any discussion on the amendment? Seems to make sense to me. Okay. All in favor of the amendment, say aye.
Aye.
Anyone who's opposed can go ahead and note yourself in the participants tab. And then on the bill as amended. Do we want to discuss it now? Should we move it as amended first and then?
Okay. Move the bill as amended?
Perfect.
Second.
Moved and seconded. Is there any discussion on this bill? You can always raise your hands. I will just say that I'm so happy to see these stakeholders together, working well together. It is really nice. And so I would like to applaud you all for that. The bill has been moved and seconded as amended. All in favor, say aye.
Aye.
Anyone who's opposed, please note yourselves. I don't see any opposition, so it passes unanimously. Thank you very much. Thanks, Delegate Collison.
Thank you, Madam Chair.
We're going to need to bring the stakeholders in for the visitation bills. So that would be 983, 806, and 276. I don't know if Delegate Lehman is here.
Don't see her.
Okay. I'm not sure if she was planning on coming or not, but I think we have a number of stakeholders interested in discussing this bill, I know. I think, so we have a lot of overlapping stakeholders on these three bills, but the bills do have, they have somewhat different, extremely different language in some cases. So why don't we start, Lisa, if you will tell us what, could you summarize both 983 and 806 for us? So that would be the Lehman bill and then also the Young bill, because I know one of the things, and I think Delegate Young is with us. It became evident in the hearing that, Delegate Young was working on an amendment to make her bill look a little bit more like the Lehman bill, because that was one of the issues that came up in the hearing. So if Lisa, you'll describe 983 for us, and then also describe 806 for us as it was introduced.
So House Bill 983 requires the Maryland Department of Health to develop specified guidelines relating to the restrictions on a personal care visitor and a compassionate care visitor that a nursing home may impose to reduce the spread of COVID-19. And there is an amendment in your packet that would expand the scope of the bill to so that the provisions would apply to catastrophic health emergencies in addition to COVID-19.
Mm-hmm.
Delegate Young's bill, House Bill 806, would require each nursing home and assisted living program to establish policies and procedures to authorize indoor visitation. So in her bill, it's the facilities that are creating the guidelines, and Lehman's bill, it's MDH.
Okay, and I think that the testimony from the stakeholders was that it would be a better approach to have MDH do that. And I think Delegate Young, you're here, right? You were having an amendment drafted to sort of move it in that direction. Is that right?
That is absolutely true, but Lisa just sent us the revised guidelines, amended directive and order regarding nursing home matters. And
hello?
Delegate, I think you muted yourself accidentally.
Yeah.
Delegate Young.
okay, not sure where I left off, but
You were saying about the MDH directive that Lisa just sent around, and then
that Lisa just sent around, and their language is all nursing homes, but I would include long-term care facilities, should follow the Center for Medicare and Medicaid Services guidance on visitation as updated by CMS, either MDH or a local health department may direct a facility to a more restrictive set of conditions at any point. I mean, that's not exactly the language that I submitted, but it comes very close. So that addresses the objections of the opposition, but my bill focuses much more on defining the role of a caretaker. And I think that's where my focus differed from the other two bills, this whole concept of a caretaker / advocate.
So that actually brings up a really good point, Delegate Lewis Young. I know that, one of the concerns I had, and I don't think Delegate Lehman is here, but maybe one of the stakeholders, perhaps Dana Kaufman, could answer this. I'm concerned that we don't want to become inadvertently become restrictive by passing one of these bills. And if we create a definition that maybe limits the number of people who could be caregivers, it might be actually narrower than the CMS guidelines. And so I'm curious about that to make sure that we don't accidentally do that. I know that's none of our intent. Dana, can you help me understand that?
Sure. So if you click on to the order, or when you have a chance, if you look at the order that MDH sent around, it has a link to the September 17th CMS guidelines. And the CMS guidelines, for example, just two issues. The compassionate care visits, it includes family members, but it also says that it doesn't restrict it to family members. It could include any individual that can meet the resident's needs, such as clergy or lay persons offering religious and spiritual support. The House Bill 983 just includes a family member or legal guardian of a resident. And then if you flip to a personal care visitor, the definition there, it says, again, a family member or legal guardian. Now, CMS in that memo does not differentiate between designations of or categories of visitors. There's actually a section where they point out that they don't recognize essential caregivers. They look at visitors as just visitors. And they don't limit a visitor to like one specific visitor only. So those are issues I think have to be reconciled, because as you said, Delegate Kelly, we don't want to be in a position after session ends where the state can always have something more restrictive. We can't have something that's less restrictive, but we don't want to be in this situation having something that could be, that could appear to limit who those visitors can be, because that's not what CMS does in its new guidelines. And again, these guidelines were based on guidelines that were issued in September. During the third surge in December, the health department rolled those back a bit, and now they're putting those back forward. The issue here is we don't know what will happen in 3 months. And again, it could go either way, depending on where the pandemic is. It could become more restrictive, or it could actually become less restrictive.
Okay, do we have questions from the committee on these? It sounds like Delegate Young has something to add.
I just wanted to respond to that. It was not my intent to limit the caregiver role to just family or a legal guardian. It could be a neighbor, a friend, whatever. It's designated by the resident. Also, it would not supersede anyone who qualifies for compassionate care because they're covered. It would provide for those people that don't qualify for compassionate care to have at least one person that could visit them.
So it seems like, and I'm sorry Delegate Lehman isn't here, she must have a conflict. Did we ever hear, Sharon, if she was going to come or not? We didn't. Okay. So, I mean, it seems like a vehicle we could work with is the 983, but we would want to make sure that the language was really clear that it wasn't being more restrictive. I know that's not Delegate Young's intent. I don't think that was Delegate Lehman's intent, but she's not here, so we don't know for sure. But nonetheless, we would want to work on language to make sure that I would guess. I'm happy to hear from other members of the committee, but I'm hearing from Ms. Kaufman and from Delegate Young that the intention is not to limit it the way the language in 983 appears to currently. So we would not. I wouldn't want to do that. How does the rest of the committee feel about that? Anybody? Feel free to raise your hands. Oh, I see. It looks like Delegate Lewis is waving. Hi, Delegate Lewis.
Thank you, Madam Chair. So I've felt a bit, I'm optimistic that we can find a solution that will serve the needs of folks in long-term care facilities and support their families. I believe we can do that, but right now I'm not. I don't see quite clearly how to get there with these two bills. One question, I have a number of questions, but one question for Delegate Young is, you said that in your bill, the resident, the person in long-term care, chooses their person. What if that long-term care resident isn't capable of choosing?
Then their legal guardian would choose.
Okay, so that's like a given, I guess, if you have a power of attorney or a
Power of attorney, right?
Okay, and then the other question I have is with regard to who defines the terms, whether it's the residential facility or whether it's the health department. And it just seems to me, especially in an environment where we have for-profit, out-of-state hedge funds and other sorts of entities running these facilities, that it would behoove us to put the decision-making power in the hands of the state, that is the state health department. I would very, enthusiastically urge that we make that decision, whatever bill we choose. And then my last question for you, Delegate, Madam Chair, is what happens I've never been through an experience like this where there were two bills with the same sort of purpose that had some.
I appreciate your question, Delegate Lewis.
How do we do that?
I think we're actually looking at three similar bills, and what we will likely do is take something from each of the bills and pick one as a vehicle, and I imagine work on amendments that satisfy the sponsors in a way that, we obviously can't pass out three very similar bills. It's extremely burdensome to the staff, and this session by all sessions, that's not reasonable. But we do want to honor all the different sponsors and make sure that we find a way to make sure everybody's getting their intent addressed. Delegate Bagnall.
Thank you, Madam Chair. I just got a text from Delegate Lehman, and she said that the link that she has doesn't work. She's trying to get into the meeting. Can we resend her the link?
Yeah, Sharon, can you make sure to do that? I thought I saw her office pop in, so your text may be delayed.
Okay, thank you.
Admitted her. Let's see, but thank you for following up, Heather. I appreciate it. Delegate Bagnall, sorry. I don't see them anymore in here. So Sharon, can you make sure please to send Delegate Lehman's office the link again? Okay, so do we have any other stakeholders who are here? There she is in the waiting room, and we'll admit her. Okay, so hopefully she's in. Delegate Lehman, are you in?
Yes, thank you.
Wonderful.
Yeah, thank you. I had a whole bunch of different links.
I know we had a little snafu this morning. There's always technology challenges, but I'm glad you're here now. And let me get you quickly up to speed. We're discussing House Bill 983 and also House Bill 806 and trying to figure out, and then we'll also be discussing 276, which was another similar bill, trying to figure out how we move forward on this issue in a way that meets the needs of the committee with these three similar bills, and trying to figure out sort of what vehicle we can use. And it does seem as though, near as I can tell, the committee's approach is aligned with what the stakeholders said in the hearings, which is having the state be responsible, which is the approach your bill takes, is probably preferable. But we were having a discussion with Delegate Young and the stakeholders about making sure that the language in this bill is not inadvertently restrictive, that if the CMS guidelines are actually broader in terms of who could be this person, or whether clergy is included, whether friends are included, etc. We don't want to accidentally restrict or narrow the language that CMS
Absolutely. Agreed. Thank you for pointing that out.
Super. So what we had talked about, and Lisa, I think we're going to need to work with the stakeholders over the next week to try and figure out what the language needs to look like to clarify that.
Okay. About who a designated compassionate caregiver is, you mean, not just a single family member, but beyond that for clergy or whomever else would be included?
Exactly.
Okay, I'm fine with that.
Okay. Do we have questions from the committee now that Delegate Lehman's here? I want to make sure she has the opportunity to answer. Delegate Lewis's hand is still up, but I'm not sure if that's from before. I guess it is from before. Okay, so it sounds like we have somewhat of a plan of action. Let's talk about 276 because it is a little bit different. And from what I understand, Lisa, it has, it's kind of broader in a lot of the definitions, but it also has a component at the end that the other bills don't have that talks about alternate means of communication with family members if visitation isn't possible. Can you give us a little update, a reminder of 276, and we'll fold that into this conversation?
I could try. I think that it's in large part, it's broader just because of the definition of congregate care facility and who was originally included in that definition. I know that the sponsor had been working with some of the advocates and paring that down a little bit. I'm not sure exactly where they ended up, but I think that was in a lot of ways how it was broader. There is a section at the end that that if a facility determines an in-person visit would be a danger to the health and safety of the patient, resident, or member of the staff, that the facility, and it's required in the original bill, shall allow for an alternative means of communication with the family members, including the use of audio or video calls. And I believe that's something that the sponsor had also worked with the advocates to change that from a requirement to a authoritative, giving authority to the facility rather than.
Okay.
But I think she's in the room.
Is the sponsor in the room? And do we have, I want to make sure we hear from stakeholders, especially on this component of the bill. Delegate Henson, are you here?
Yes, Madam Chair.
Oh, wonderful. Thank you. So on the, particularly on the audio and video visit component of the bill, where did you work out an amendment on that, or has there been conversation on that?
I did work out an amendment, and I believe that committee council stated that correctly. The amendment that was worked out changes the word shall to may, and the effect of the amendment is it gives them the authority that if it's impractical or unsafe to have the visit be in person, that they can fulfill that obligation with an alternative method, that being audio or visual for the video or for the visit to take place.
Okay, great. And then in terms of the other part of the bill, which contains all of the definitions, I know there's a lot of potential amendments there, and there was a lot of stakeholder interest in that. So I want to make sure we have some conversation. I'm just not sure who's here. Let's talk about this in two different parts. So first on the audio video language, is there any stakeholder here that has any concerns about
I'm
that?
sorry, I can't see that far.
Speak now, pipe up. Can we hear from anybody on that one? Do committee members like that? Anybody want to weigh in on this at all? I know it's confusing because we have a lot of different moving pieces with this here. I'm looking to see who is in the room. Oh, it looks like Eric is raising his hand. Eric.
Hi, unmuting. I just want to applaud this initiative because, as folks know, social isolation, which all three of these bills are trying to get at, is such a huge issue. So having this as an option, encouraging the use of technology when possible, it's just really a phenomenally important aspect. So I'm really pleased and thrilled that the subcommittee is highlighting this particular aspect of it.
Great, thank you. And I see Delegate Collison is trying to raise her hand in some way. Delegate Collison.
Right. Thank you, Madam Chair. I'll just say ditto. Eric just said what I was going to say.
Great. Well, I know we have some stakeholders from Leading Age here. Did you want to weigh in on any of the conversation we're having?
Hi, Madam Chair. Thank you. Yes, we recognize the huge issues of social isolation and just echo what Eric was saying, that it's such an important thing for us to be addressing. And I think many providers are using technology really well to do this already. And I think one of the biggest barriers is access to having those devices to do audio and video connection for residents and families, and then just staff time of doing that. But I think providers across the board are working really hard to make that happen. And so we would, support the use of technology to help with social isolation in any way we can.
Great. And thank you for that. And let's hear from Joe D'Amatos, who also has his hand up. Thank you.
Yeah, I just want to ditto what Eric and Allison said. A number of folks in our space early in the pandemic went out and actually bought stuff to be able to do this, recognizing that it was going to be a challenge. I will say, in full transparency, in moments where the surge was really intense, and as Allison said, and we were fighting to save lives, when you had to choose between caregiving and dialing up on FaceTime, people focused on caregiving. But, I think it's very important that we state publicly that we need to do all we can to limit isolation, whether it's in person or using technology, while keeping residents and patients safe. So I just wanted to chime in on that. Thank you
very much. Looks like Barbara Bricado has her hand up.
Hi, thank you, Madam Chair. Barbara Bricado here on behalf of MACRA, which is an organization of the voice of residents that live in continuing care retirement communities, and want to applaud and echo what everyone has said here, but really want to emphasize the requested amendment to include continuing care retirements in the list of these entities. They include assisted living, nursing care, and independent living. Often when one family member might be in assisted living or in nursing care, their other family member is in independent living. And there's truly a need for them. Again, all of the issues that you've just discussed, but this is clearly a continuum of care where everyone goes back and forth. So we would ask the sponsor and the committee to consider supporting our request. Thank you.
Thank you. I'm looking for any other stakeholders who have any comments to add. I don't see any. Do we have any more questions from the committee? I'll give you a chance to raise your hands and give you a sense of where I think we're going to be going, because we definitely want to vote on something next week. We don't want this to get bogged down before crossover. It sounds like we need to combine some components of these bills to work on clarifying the definition to make sure that we're not inadvertently becoming more restrictive than the CMS guidelines, and come back with those amendments and discuss and vote on this next week. Does that sound about where the committee feels like we should be? I'm seeing some heads nodding. If anyone else has anything to add on this issue, I see, two more hands. Looks like Delegate Cullison.
Thank you, Madam Chair. And I apologize, I should know this. Are these emergency bills? Are we going to end up with an emergency bill?
That's a great question. I don't think that, go ahead, Lisa, do you know the answer?
Yeah,
I don't think that they are.
Mine doesn't have the term emergency in it, but it's effective June 1st. So the effective date is pretty quickly.
I mean, we might as well, if we're doing amendments, slap on an emergency bill amendment, right?
Right. That's what I'm thinking.
COVID.
I mean, we are still living through this. We're going to be living for at least 6 or 7 more months at least. So I guess my intent would be if we're going to be when we pass the bill, we want it to be effective as soon as possible.
Okay, so we will work with committee staff over between the next meeting on these amendments. Looks like Dottie Burtz Markowitz wants to add something. Dottie, are you here?
She needs to unmute. Here we go.
Sorry, still not used to that.
Happens to us all.
I'm a private citizen who has a husband in long-term care. I've been working for several months to see essential caregiver be something that can happen in Maryland. And I just wanted to, based on conversation, to impress on the delegates that I think it's very important to have the term essential caregiver separate from the term compassionate, because I think there will be a lot of confusion if we don't have two separate terms for those two separate kinds of programs.
I'm taking a note of that. It looks like Delegate Riley has a question.
Yes, thank you, Madam Chair. In reference to I like the option of the audio and video. But a question in the bill, is this the responsibility of the facility or the family member to make that happen?
I think the sponsor of the bill is Shanika. Delegate Henson, are you still here?
Yes, Madam Chair, thank you for the question. The amendment to that provision would take out the shall and add the may, and the effect of it is that it authorizes it for the facility, so it gives them the option of having the visit facilitated by audio and video when it is impractical to have the visit be in person because it's unsafe or it's not feasible to have the visit take place in person. So it puts it on the facility, but it gives them that option as an additional resource for them to facilitate the visit. It doesn't require them to do so as a mandate.
Okay, so then they make their own regulations on where that would be, whether the patient would be moved to one particular location where the audio video is available, or whether they're putting it in their individual, residences. That's all for them to make their own regulations. Is that what you're saying? If they want to opt in to do that?
I think it's a matter of making policies, not regulations, because these are independent businesses.
Okay.
So each
All right.
business would have their own policy. We have a question. Oh, we had a question from Delegate Saab. I think he lowered his hand. Joe D'Amatos, did you have something to add?
Yeah, just real quick, I've seen it work over the last year, both with family members bringing a device, dropping off a device, and I've seen more often centers having a device. And just to follow up on just the earlier quick bit of communication, Maryland was one of the first places in the country that allowed for cameras in private rooms, and we already have existing rules and regulations about the use of video in a private room in a nursing home. It has to be disclosed. It has to be agreed upon. It can't face into the bathroom. It can't face another person in the room. Those have been in place for a long time. So just sharing that for the good of the order.
Thank you very much for that. We appreciate that. I've lost track of things. So Delegate Saab no longer has a question, right? That is correct. So I think with that, and with Delegate Cullison's suggestion that we also add an emergency bill amendment, Lisa, let's work with the relevant stakeholders over the next week to make sure we have amendments that everyone agrees to, that gets at what we're trying to get at for this issue. Is there anybody else who has anything that they feel like they need to add on any of these three bills? I'm going to give you a second to raise your hands just to make sure we've heard from everybody. And while we do that, let's make sure that the stakeholders for Delegate Valentino Smith's bill are let in the room. All right, I think we're in good shape. Thank you everybody for a really productive discussion.
Did Allison have a comment?
Allison.
Thank you.
Oh, thanks.
I just wanted to add, for many weeks, providers have been asking, when are CMS and CDC potentially going to revise the visitation guidance now that many residents in nursing homes specifically have received a vaccine? And for weeks, the response from CMS has been not yet, not yet, not yet. Well, this week, we heard from our national counterparts that CMS and CDC are working on this closely and hoping to be able to further loosen the visitation restrictions. And so I think it just points to the fact that we need to be careful to not at a state level put anything in place that would be more restrictive, because the current order states that Maryland would follow whatever further guidance or changes CMS and CDC make in that instance. So just wanted to point that out.
No, that's really important. I appreciate that. And your comment reminded me that we haven't yet discussed the amendment that Delegate Lehman has sent the committee on catastrophic health emergencies. So I feel like we might want to discuss that too. Delegate Lehman, are you still here? Can you explain to us that amendment?
Sure. So I, as soon as I had the bill drafted and got it back, and it only referenced COVID-19, I realized, before the ink was dry on it, it could end up being irrelevant. That was my concern. And I consulted, some other folks who said, yeah, you probably want to make that broader. Initially, I was thinking of other strains of COVID. There's talk of this UK strain, and what if suddenly we're referring to COVID 2020 or 2021 or referring to it by another name, and then the bill just immediately is moot. And then in thinking about future health emergencies, I discussed language back and forth about whether we should use the term pandemic. And there are different interpretations. The World Health Organization and CDC often don't even agree about, when a situation is a pandemic. And so what I came up with in talking to folks in bill drafting and some of the advocates was this, the same language that Governor Hogan uses, or that is used in the public safety article. That's where that language actually comes from. It's the area of law that he has been declaring, during COVID. He has been issuing regulations, guidance, guidelines. It's that specific language, and it is catastrophic health emergency. So it mirrors that language in that part of the law where Hogan has been doing this work for the duration of the COVID-19 pandemic.
Great. Let's hear from Delegate Cullison.
Thank you, Madam Chair, and thank you, Delegate Lehman, for that explanation, because that's absolutely, that's my experience as well. And as we've been thinking about the impact of COVID-19, it's really been in this broader context of a catastrophic health emergency. And I think the product that we're going to come up with has to address this instance going forward. We can't limit it to the current experience. So I think I'm really happy to see this amendment and glad that it's broader, because if it can happen in 2020, it can happen again. So we want to be prepared the next time. So
thank you, Delegate Cullison. That's absolutely what I was thinking about. And I also just want to point out briefly that at the recommendation of some of the advocates in the industry, I did ask for an AG advisory letter, which you should have a copy of, saying that this is not intended to supersede the governor's powers to declare an emergency in the first place. So I did dot that I, if you will, at the recommendation. I appreciate that recommendation. I would not have thought to do that on my own.
Do we have any, have the stakeholders gotten a chance to take a look at this amendment yet, or do you still need time to look at this before weighing in on your opinions? Any stakeholders have anything to say about this at this time? It looks like Dana Kaufman's hand was up. Yes, Dana.
Now, the only thing I would want to say, and Delegate Lehman did point it out, that, again, you always have to be judicious, because we don't know, help us all, what the next pandemic could look like. So trying to legislate for the unknown can be very difficult. But as she said, the governor's the governor's executive authority would always supersede as well. So I think we just have to be mindful of both.
Okay, that's helpful. And we'll take a look at this language, and we have a week until the next meeting, so we'll make sure that it makes sense to everybody. Eric, go ahead.
Sorry, just one final comment that I'm not sure I've heard addressed in this conversation. The staff at assisted living facilities and the staff at nursing homes really are doing yeoman's work during this time. They're experienced professionals. So one thing I did just want to add to this dialogue is making sure that if there are essential caregivers, people coming in to do this core role, that they're not usurping the role of the trained staff at nursing homes and assisted living facilities, and not supplanting what they are, because the staff there are experienced professionals, and just want to make sure that these are a complement and not a substitute for folks doing great work.
Excellent. Thank you very much. Dottie Burtz Marowitz. Dottie, are you still here?
She's muted.
Oh, I just never remember that. Thank you for bringing that up. I think it's really important to think about the staff and everything we do around these issues. I've had the privilege of being able to see my husband under compassionate care, and I do call it a privilege because I do think compassionate care is inherently inequitable, and that part of my reason for supporting essential caregivers is because it's more equitable. I just want to say that in my experience under compassionate care, the staff, particularly the permanent staff, are so happy, so very, very happy to have family members and our friends, whoever it is, that can fill that role to be there. It makes their work so much easier.
Thank you very much for adding that. Any more final comments on these three bills and the process we're going to go through with them? Delegate Bandari.
Yeah, thank you, Madam Chair. It's the same question. I mean, these are the great bills. I really like the bill, but it seems to me that during the hearing, we heard a lot. The visit to this long-term care are highly dictated by CDC guideline, and we need to meet these certain metrics, how we can move forward with these bills. I mean, we can figure out whether we need to reach out to our federal partners or how this legislation will be effective. The implementation, pragmatic side of these bills.
So is that a question for me or for one of the stakeholders?
No. I mean, just the stakeholders.
Yeah, I feel like either leading age or lifespan might be able to answer that effectively. I think that the Lehman bill is the vehicle that they felt like would be most capable of doing that, but we want to make sure to take the components from the other bills that we feel like we can reasonably do with language that works. But I don't want to speak for the advocates on the issue. So if any of the advocates want to weigh in on that.
Jana, I think Jana could be the best person on this.
And I think what you just raised is the challenge that we have right now. Since nursing homes are regulated by CMS, they are always going to be required to comply with CMS. So it's trying to craft a bill that has flexibility built into it so that we don't inadvertently become more restrictive. And as Allison had pointed out, the industry themselves has been asking CDC and then CMS to take another look at the visitation now that we have vaccinations in the nursing homes to see if we can even loosen some of the restrictions, but keeping in the public health aspects like the screening. So at this point, it is an area that we just have to move carefully on, but you are correct. It is a delicate balance.
And so it sounds like, Anna, if I can try and summarize how I think I understand it, we're basically trying to pass a piece of legislation that provides these baseline assurances that are consistent with the federal guidelines, but that also has the flexibility so that when the federal rules change, we are not more restrictive than the federal rules, while at the same time understanding that the governor will ultimately be able to override these as needed if it is needed.
Absolutely.
All right. Okay.
Good summary.
So we're threading a lot of needles here.
Yes.
Sewing machine.
Thank you.
Great. Okay. Any more questions or comments from the committee on this before we move on to Delegate Valentino Smith's bill? I'm going to go with no. I see none. So now we're moving to 674, which is nursing homes, transfer of ownership, site visits, and surveys. And I'm going to have Lisa give us a reminder of this bill, but also I know the sponsor has been working hard recently, so probably has some updates for us. Lisa?
Oh, Lisa.
I'm coming. All right. House Bill 674 requires the Maryland Department of Health to make site visits and conduct full surveys of a licensed nursing home if ownership of the nursing home is transferred to a person that does not own or operate another nursing home in the state at the time of transfer. MDH must make site visits and conduct a full survey within 1 month, 3 months, 6 months, and after the date of transfer under the bill. In your packet of documents for the meeting that was sent out on, let's see, on page 6, there is an amendment that clarifies or it changes the requirements for the surveys. On page 7, there is an Attorney General's letter that explains that the bill is not conflicting with federal law. And on page 9, there is some information that the sponsor of the bill provided from the budget analysis on pins at OHCQ.
Okay. Delegate Valentino Smith, do you want to say anything about where we're at now with this bill?
Sure. Thank you, Madam Chair, members of the committee. Again, I really want to compliment you on the efforts of your staff who had been working late last night and early this morning on these amendments. Thank you, Ms. Simpson. Herculean effort. You recall that the attempt of this bill is to address the situation that we've seen evolving in Maryland, where the majority of transfers, and MHCC has confirmed this, are for-profit nursing homes, some of which are likely operating under the new investment model that allows real estate investment companies to purchase nursing homes. And in December, we got besieged with newspaper articles about immediate problems with quality when we didn't know the actors. They had acted in other states, but not acted here. So with Senator Bidel, the intent of the bill was to say, look, you're supposed to have a full survey, and you see that in current law on page 1 of the bill, that you're supposed to have a full survey of each licensed nursing home at least once per calendar year. The intent of the bill was to say, let's require that full survey to be done within the first 3 months of somebody that's never operated here to be done. And so we struck the original bill, which said to do it at 1 month, and we said, let's do it within 3 months. Full surveys by definition are unannounced, as I've been told by OHCQ. Last night I was on the phone. I really want to thank the department and OHCQ. Although they have no position on the bill, I always think it's important to work with them on the practicality of the bill. And what I am proposing, having discussed with them the practicalities of the bill, or that we do a full survey, which by law already has to be done once a year, within the first 3 months of somebody that's never operated in the state of Maryland, owner operated a nursing home and coming in. And within 120 days, do an on-site follow-up of that survey. The reason we say on-site is that nursing homes submit a plan of correction for survey findings, some of which do not require an on-site, somebody to go back on site and review it. There's just acceptance of the plan of correction until the next annual review. And so what we're suggesting is that the one new addition here is that within 120 days, and we picked 120 days instead of the 3 months, is because it takes them maybe a couple of days while they're on site doing the full survey, 5 or 6 days. It takes some time to go back and write up the survey, and then it takes them time to transmit those survey findings to the nursing home operator. And so that's why instead of saying within 3 months to come back for an unannounced site survey, I, and have been talking to Senator Bidel and working with the department, tried to meet them with what operationally they thought would be something that worked rather than the 3 months. So the amendments and the intent of the amendments, I think I have to work with Ms. Simpson on the language of the amendments, is that in the first 3 months, they do an on-site full survey, and within 120 days, they do an on-site survey. And that's the bill, Madam Chair. I did want you, I know, look, the department's always behind in their nursing home surveys. Not a surprise to you, not a surprise to me on the audit committee, because that's what we hear and listen to all of the time. They're much more backlogged in their assisted living facilities than they are in their nursing facilities. So what I included was there's been budgetary language that has required the addition of additional surveyors each year, I think until FY 2025. And so they got 4, then they got 5, and they're getting 4 purely dedicated to nursing homes. And so the idea is they have to do these surveys anyway. Let's just make them do it sooner than later if somebody's never operated here before.
Thank you for that clarification. And do the amendments that you have in any way, I mean, obviously you've addressed some of the questions in the fiscal note just by those points you just made, but does the amendment help reduce the impact also, or no?
And as the fiscal note writer wrote the amendment, obviously, it's unclear the numbers that they're basing it on.
Right.
The number of new transfers that they think will come in. I think that the department, I have to look back in my notes, is the department might be on. I think they said there were only 8 or 9, and I think she based it on a lot more that might be coming in. But the taking away the 1 month definitely changes, what the original bill was requiring in terms of effort.
It should significantly reduce the impact going from 1 month to 3 months. Okay. Do we have delegates?
And the fact that I'm sorry, Madam Chair, the fact
No.
that they have to do this review anyway, we're saying do it at sooner than later. So the dedication of resources is already required. And that's what we were trying to get the fiscal note writer to acknowledge, but we weren't successful.
So simultaneously, the dedication of resources is already required. And from your perspective on appropriations, the resources have largely been allocated.
And will continue to be allocated.
Okay, let's hear from Delegate Bandari and then Delegate Saab.
Thank you, Madam Chair, and thank you, Delegate Valentina Smith, for bringing this wonderful bill for quality of care and oversight. And during the hearing, if I heard correctly, these 75% of these facilities are by private investor. Did you reach out to them? Is there anybody here representing them, those private investor?
No, I think, and you have the chart in front of you. It's hard for me because remember, I can't see everything like you can in the floor system, that there was no opposition to the bill and that the industry representing the nursing homes made the amendment that we remove the 1 month, which is what we complied with.
And I see Dana Kaufman has raised her hand. So before we get to Delegate Saab's question, Dana, did you have something to add?
Thank you. And we do support the bill. We do think that the changes that Delegate Valentino Smith put forward with the 3 months and then within 120 days work much better for operation. I'm a little confused because the amendment that I have in front says an on-site annual, but the delegate is saying full. And after 18 years of representing this industry, I actually learned something new. And I think that there are 2 different surveys. So I would like to get a little bit more information on what those differences are, because I was under the impression that the annual survey is really the one that goes through the regs and the quality measures, which would be what we thought would be more appropriate for this. So I think that that's an issue that I just have to get a little bit more understanding of, and I can talk to the delegate after.
No, and you must have some kind of telepathy, because I've been on the phone last night and just hung up from the department working with the differences between what annual and full mean. And the current statute in line 17 through 19 require a full survey of each nursing home at least once per calendar year. And so that's why I need to work with Lisa. I think we need to be consistent with saying we wanted the full survey, which is the one that was supposed to be done yearly, and the on-site follow-up of that. The annual, or what they do, is something they do consistent with federal law. So does that help a little bit?
Well, OHCQ is the agent for CMS. And
right, they do the annual.
Yeah, so I still think that there might be a difference between the terms. So maybe you and I and the others can talk offline and just get a better understanding of that.
Thank you.
And I know we played some phone tag.
All right, so we will work on getting some clarity on the annual versus full issue in the next week as well. We have a question from Delegate Saab, and then we'll hear from Joe D'Amatos. Delegate Saab.
Thank you, Madam Chairman. Actually, Dana brought up one of my questions. I'm just trying to get a little more clarity on amendment number 2. Are we extending, we're striking 6 months and shortening the survey time to 120 days? I thought the facilities wanted a little more time. Did I misread this, or can someone clarify that the 6 months is actually shorter than the 120 days?
Well, timing wise, what we were trying to do was operationalize it consistent with what the department thought would work better, which was, since it says within 3 months, they may get in there in month 1, month 2, or month 3. And so what we wanted to do was give them the full 120 days from the time they originally went in, which may fall before the 6 months, but could fall a little bit after the 6 months. We thought 6 months was too prescriptive because it might not allow the same amount of time for the nursing homes to respond to the findings.
It was shortened to 120 days.
From the time of the, right,
Okay.
but it
All
was
right.
within 6 months after the date of transfer. It didn't, the original bill didn't designate within 6 months of the time of
Okay.
the survey.
I got it now. Thank you. I appreciate it.
Dana, your hand is still up. Did you want to add to that before we go to Joe? Dana's hand is down. Joe, Joe D'Amatos.
Thank you. No, I really appreciate the sponsor's amendment and working with the department. We supported this legislation. We asked for the 1 month to be removed. I can speak for that in a moment. Under current law, any of these visits and surveys could happen presently in Maryland, but making it more explicit, having the 120 days for the plan of correction, I think makes a great deal of sense. I appreciate that, Delegate Valentino Smith. Seems workable with me. Dana brought up exactly my point about annual versus full. So I think there is some work to be done on that. If I were sort of writing it now, I probably would call it an annual, but we can do that offline. The reason why we originally, by the way, struck the 1 month wasn't only about the timing, but it sort of also speaks to Delegate Bandari's question. Just because somebody, an entity buys either a for-profit, nonprofit, comes in as a for-profit, nonprofit, their tax status doesn't matter. And quite frankly, their financing structure largely doesn't matter. The reason why we struck the 1 month is what's not thought about in this framework is what happens if we have a Maryland provider who is under-resourced and driven a nursing home into the ground, and somebody comes in with more resources and does better, and they need more than a month to turn it around. While there have been media accounts of folks that were venture financed that may or may not have done that, and thus this legislation, there are also people that came in and acquired and infused tremendous amounts of capital into those centers, right? So that's why we did that. So just by way of background, that's an answer to Delegate Bandari's question.
Wonderful. Thank you very much for that. It sounds like with this bill, we're going to get some clarity on the annual versus full issue and come back to it next week. Let me just remind the subcommittee, next week we have the compact bills coming. So we have 4 of those. We have to come back to the visitation bills. We have to come back to this bill. So we're going to have a longer than 1 hour meeting next week is my guess. I will try to keep it to 1 hour and 10 minutes because I know everybody wants to eat. And with that, we made great time on this meeting in 59 minutes. Anybody have anything else they want to add before we adjourn? I will look for hands. And I don't see anything, so I will end with the customary and very necessary thank you to the staff for running such a great meeting, and to Lisa Simpson for doing all of the heavy